So please tell us, what exactly is anxiety?
So before we discuss about anxiety, I would like to just share with you what mind is. Okay. So in general, what we have a feeling about mind, generally if I ask somebody that what is mind, they will not be able to give a perfect answer. But what I would like to share with our viewers is, what is mind? Mind is what our previous experiences are. So based upon our previous experiences, we are what we are today, and that is our mind in short. So to explain, see, there are two things which come to our mind when we discuss about mental health. One is our mind and one is our brain. So we need to differentiate first what our brain is and what our mind is. So just imagine, if you want to travel to Mumbai and your brain needs to go to Mumbai, it would take 3 hours, 2 hours, whatever traveling distance. But when it comes to our mind, it goes within seconds to Mumbai. So that is the power of the mind. And in general, when we discuss about diseases, if I ask you to name a few diseases, what would you name? Just name 3 diseases which are coming in your mind right now.
Fever, if I could call it a disease, diarrhea, fever, typhoid, cholera.
Yes. So see, you've named 4 diseases which are all related to our body and not to our mind. That is where we can come to a conclusion that mental health is being given the most least importance. Whereas we have n number of diseases, okay, related to our body. And in the same way, we have n number of diseases related to our mind, which nobody gives importance to. So, anxiety is one of them. Now, to describe anxiety, what I would like to explain is, see, everybody has some amount of fear in them, and fear is an emotion. So, when we discuss about fear, if it is in limits, it is normal. But when it goes out of our hands, we get anxious. So, that anxiousness, if it takes us in the wrong path, that is where the problem arises. Now, I had a patient with me a few years back. So, to explain in a brief thing how anxiety is and how we will be able to diagnose anxiety, I'll just explain it to you. Now, this patient who was in her 10th standard, hmm, and the whole year she did not work for her exams and didn't study. Now there was only 1 month left for her exams. Now what happened was, she started developing a fear. How I'll be able to study? What happens if I don't study? Will I be able to write my exams, pass my exams? Are all the thoughts that were coming in her mind during that point of time. So, in that fear, she is not able to face her exams properly. That is what in general we call it as examination fear, because of which her exams were not up to the mark. She was not able to clear them. Only because of the reason was anxiety. And when coming to a general this thing, what we find is, children, although they don't study the whole year, they work hard in the last 1 month. That is also because of anxiety, a fear, like what will happen if I don't work hard? How will I succeed in life? I this should be a stepping stone. This should be a stepping stone for my coming days. Is what comes in normal children's mind, and they come out with flying colors. Whereas this patient could not face her exams because of that examination fear in her. She ruined her exams. So that is what is anxiety. When anxiety becomes a stepping stone for us, it is normal. But in this anxiousness, we spoil our current situation in our life. So that is pathological. Now, coming to one more example, what happens? See, there was one more patient, a lady. Okay, she was married, she was having 2 children. It was a nuclear family staying in a metro city. So, what happened was, she started developing anxiety. There were n number of reasons for that. She wasn't having a happy marriage, and as she wasn't having a happy marriage, there were fights in the house regularly. Over a period of time, what happened was, she started becoming more and more anxious. Now, when her husband used to travel to work, And if he didn't respond to her calls, what she would do? She would call regularly to her husband continuously. It would go up to 20 times, 30 times. So, with that, you can sense the state of anxiousness that was there in her mind. In the same way, if the children didn't come back home, if 4 p.m. was the time when they had to come back home, if it was 4 5, she started calling the school, she started calling the transport person, her husband, and this kept on increasing. Now, what we are noticing here is she used to create imaginary situations in her mind. What has happened? Why haven't my children reached home on time? Have they met with an accident? Are they in a hospital? Is there any head injury which my son has suffered? Is the body of my child normal? What has happened? She's just 7 years old. Has somebody kidnapped them? These were all thoughts that were coming in her mind. So this is anxiety. Now you can sense what pathological anxiety is, what normal anxiety is.